I'm about to tell you something you've probably never heard about your post-vasectomy pain. That testicular pain you're having is probably not coming from the testicles. In fact, your pelvic floor might be the culprit. I've gotten a lot of requests lately to make a video dedicated specifically to post-vasectomy pain. So in this video, my lovely assistant, Timmy the Testicle, is going to help me explain to you why your pelvic floor might actually be the culprit in your post-vasectomy pain. To do that, I wanted to use an anatomy model that I use in my clinic to give you a much better understanding of what are the structures down there and how might they relate to testicular pain or other pain that you have after your vasectomy. And we'll also talk about some possible ways that you can begin a self-guided recovery plan to get rid of that pain and get on with life. This is a model of the male pelvis. You see the two pelvic bones here, and the reason I'm talking about that is I want you to see what's attached to them. Your abdominal muscles end up attaching to the pelvic bone right here. What you see peeking through here is the spermatic cord going to the testicles. And what's interesting about that, and what might make a difference for you to know, is that there's a layer of muscle tissue that comes from the abdominal area that goes all the way around the testicle, as well as fascia or connective tissue and nerve tissue. All of those literally have a physical connection with your abdominal area. That's why I look at the abdominal area as well when somebody's having post-vasectomy pain, because those abdominals might be really, really tight and we need to work on that. Down below, right here, you have your deeper pelvic floor. Now the pelvic floor is pretty complicated. It's over 20 muscles in 3 separate layers. This is the deepest layer. And if someone is also having rectal pain or a deep prostate kind of pain, we often look at this layer of muscle. Now what's most surprising and what most people don't get examined and don't get assessed is layer number 1. I want to show you where that layer 1 is and why it might be the culprit. You have testicles, penis, but underneath you see these muscles here. That is your layer 1, or your more superficial layer, or the front layer of the pelvic floor. They start here on the side of each sit bone. They actually go all the way around the anal opening, come back up, and they hug the sides of the pubic bone, but look where they end up. Right at the base of the scrotum and right at the base of the penis. That is very close proximity to the scrotum and pretty close proximity to where that vasectomy is. There is soft tissue from the scrotum that basically covers this area. And so there is a physical connection with these muscles as well. Often what we find when we do an assessment is that these muscles here are very, very tight and very tender to any kind of pressure, whether that is fingertip pressure or, as you may know very well, whether that's sitting down on any kind of surface. When you're sitting down, you're literally sitting on this area of your pelvic floor. And if it's really angry and fired up, you are going to get pain when you're sitting. The yellow is nerves. And you see a whole lot of nerve tissue coming from here down, and they can be a source of pain as well. Likewise, on the front part of the pubic area, you have this grayish blue tissue, which is called fascia. Fascia is a web-like formation of connective tissue, and it surrounds all of this area. it can get tight and restricted as well. And when that is restricted, your tissues, the muscles, the structures cannot move like they should, and often people will end up getting pain. Another area that is way underlooked in post-vasectomy pain isn't even in the pelvic floor. It's in your low back. Yes, in your low back. And here's why. There are nerves that come out of the spinal cord, go down here. This is your sciatic nerve here. You've probably heard about that. But coming off the sciatic nerve is this little branch. It's called the pudendal nerve. But what the pudendal nerve does is it branches off into 3 sections. And you'll see this on the model in yellow. The first branch is called the rectal branch, and that is right here. That goes to the area around the rectum. If it is ticked off, a lot of times guys will have what feels like rectal fullness, pain, I feel like I'm sitting on a golf ball, etc. The second branch is called the perineal branch, and it goes to these muscles right here in the front of the pelvic floor. If this branch is ticked off, it can cause pain in that sitting area or the perineal area. And finally, the last branch is the dorsal branch right here that goes to the tip of the penis. If you've ever had that zinging feeling at the tip of the penis, most likely that's the nerve that's involved. So it's important to maybe look at the low back as well and see if there's any soft tissue restrictions or movement restrictions that are not allowing those nerves to function the way they should be functioning. Surprised by that? A lot of people are. And that's about it for the anatomy. I hope that helped you connect the dots better and give you a better understanding of why you might be having pain down there and where it might actually be coming from. The next thing I want to talk about is, what do you do about it? How can you start on a plan to help relieve that post-vasectomy pain? Honestly, if you can do it, by far the best way is to seek out a qualified pelvic floor physical therapist who treats men with pain issues. They can really help guide you in a personalized program to help relieve that pain and give you tools that you can manage it the best or keep it away for good. Now, I know that not everybody has access to pelvic floor therapy where they live, so that's one reason I'm doing these videos. While I cannot give a personalized program for you, I can give you some general guidelines and share some things that a lot of guys have found very, very helpful in reducing or even eliminating their pain. One of those tips, and you'll probably be shocked by this, is breathing. Yes, breathing. It's not hocus pocus. It's not woo-woo stuff. It works because of the pelvic connection to the diaphragm. Working on some guided breathing exercises can make a world of difference, and we have references in other of our videos on how to get started with that. The second tip is stretching. Stretching not only those pelvic floor muscles in front, but also stretching the muscles of the inner thighs, the glutes, the outer thighs. We've got some very easy and comprehensive stretches that you can start right away to help ease some of that tension, which could help relieve some of the pain and take the pressure off some of those nerves. The third tip is figuring out what ticks off the pain. And that's different for every guy, but there's usually a pattern. And once you find what that pattern is, then you can develop strategies on how you're going to tackle that problem and how you're going to develop new habits and strategies to overcome those pain patterns. Fourth tip, especially if you are one who has pain when you sit, finding some good products that can help you relieve sitting pain. Now, that can be as easy as a couple of swim noodles. Believe it or not, we do have a video on that if you want to check that out, and how you can use a swim noodle to eliminate sitting pain. But other products are just as effective and can be really, really good, especially on a car ride or if you have to sit at work. Other suggestions like having a standing desk can be super helpful if you have to sit at work. You can alternate between sitting and standing, and that can help as well. Thanks for watching. I really hope this video gives you a lot better understanding of the role that your pelvic floor plays in your recovery from post-vasectomy pain. If you would like to learn even more about what you can do to help your pain, I want you to check out the resources that we have listed below. Also, feel free to share a comment below. We would be happy to answer it the best we can. We'd be happy to help connect you with another pelvic floor physical therapist who might be in your area and can really provide a lot of help.